Greetings, everyone. My name is Kathy Moore, and I am the privilege of serving as moderator for today's webinar. I'm glad you're all able to join us. Looks like folks are trickling in. We do encourage you to keep using the chat box and introduce yourselves there. It's always helpful to hear where folks are from, and it's a small way of helping to cultivate community amongst all of us. So also encouragement as we get into the webinar, feel free to use the chat box to raise any questions or share some of your thoughts about the presentation and the conversation that ensues. We'll be doing our best to keep an eye on the chat box, and we'll try to filter some of your questions to our speakers and presenters as we proceed. With that, I will do a little bit more of an introduction about our actual presenters, Shanti, Kulkarni, Evelyn Hill, Wanda, Gilbert-Coker in a few moments. But let me begin by giving you a sense of who's sponsoring this webinar and who's organizing this, and set the stage and frame the conversation a little bit. So here you see, this is all of the different players who are part of the Domestic Violence and Housing Technical Assistance Consortium, or DVHTAC. This is a really unique collaboration. It involves a number of federal funding partners. You see there the FIPSA office, the SNAP's office at HUD, the Office for Victims of Crime, and the Office on Violence Against Women, as well as the U.S. Interagency Council on Homelessness are all our federal partners. And they've brought together and provided resources for several of our technical assistance partners. So we have the National Alliance for Safe Housing, Collaborative Solutions, National Network to End Domestic Violence, our organization, the National Resource Center on Domestic Violence, National Sexual Violence Resource Center, as well as the Corporation for Supportive Housing. And we all work together to try to organize webinars like this and provide technical assistance and lots of other resources for the field around the issues of domestic and sexual violence and housing insecurity. Excuse me. So as I start to frame this, I see there's quite a bit happening in the chat box. So I want to let you all know that yes, we are recording today's webinar and we'll make it available. And before I go any further, I also want to give a shout out of appreciation to my colleague Brittany, who has organized all the tech support for this webinar and is making this possible and responding to some of your comments there. So in terms of today's presentation, you'll be hearing from some brilliant researchers and survivors and thinkers and who are going to share their perspectives on housing insecurity for communities and survivors who come from marginalized communities. And it's important that we really think about, this doesn't just happen in a bubble. There's a lot going on for survivors. And so we're going to take just a couple minutes and look at issue of domestic and sexual violence and all the layers around that survivors are currently feeling and experiencing, layers of COVID, as well as housing insecurity, and looking at intersections around racial disparities and health outcomes. So let's move along. Thank you. There's a number of different stats we can all pull in terms of domestic and sexual violence. This happens to be one from the CDC, and it's from a ways back, but here you see some data around physical violence as well as sexual violence, and we've broken it down by what women and men are reporting. But in particular, we highlighted, you can see American Indian and Alaskan Native, as well as Black, Hispanic, and Asian other Pacific Islanders, excuse me, are experiencing disproportionate rates of domestic or physical and sexual violence. Those percentages you see, they're overrepresenting their population, their overall population. And so the impact of domestic and sexual violence are landing more heavily on those communities. And then we think about COVID and how it's affecting survivors. You'll hear from Dr. Shanti Kulkarni a little bit later. She's not actually going to be talking about this research, but she was able to really pull together some information pretty quickly this summer to help us understand how COVID-19 is affecting survivors. And here you see survivors are concerned and very afraid about becoming infected, their financial needs, as well as healthcare needs and childcare and food, as well as the need for some COVID information in various languages to help people really be able to understand and know how to protect themselves and their families. So related to all that is asking, how is COVID impacting housing insecurity? And so this was some research that was put out again late in the summer. And at that point, it found that 1 in 4 people reported housing insecurity, and that was defined by not being able to pay their rent or mortgage on time, and or being concerned about not being able to pay it in the following month. And so that's a pretty high percentage for our general population, but in particular, the same survey found that Black women and Latinas were even more, had even more concerns about housing insecurity. They had 2.5 times more likely to experience housing insecurity related to COVID than white men. And for Black women and Latinas with children, it was even higher. And so again, when we think about and we understand that those communities are experiencing higher rates of domestic and sexual violence, we understand that COVID is impacting, excuse me, communities of color more significantly, and now we're looking at housing insecurity. It's a lot of intersecting sort of layers that are really landing on the shoulders of survivors. So the final piece in this framing is we want to share this brief animated infographic with you that we feel really pulls these pieces together in a compelling way. So I'll let Brittany go ahead and play that.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it, so we can do more about it together. To learn more, visit safehousingpartnerships.org.
Thanks, Brittany. So with that, setting the framing and kind of the context for what we're about to cover here, I want to turn our attention to the cycle of housing insecurity. And as they begin to share about this concept, I want to let you all know this is actually part of a paper that has just been completed and has been posted on our Safe Housing Partnerships website. It's the third in our special series on coordinated entry and domestic and sexual violence. Thank you, Brittany, for mentioning the closed captioning. So this is the third paper in this series on coordinated entry, and hopefully you've seen those other papers. We have one about the limitations of the VSPDAT assessment tool. The second paper is really talking about shifting and moving away from a scoring sheet and moving more towards a decision tree. And engaging folks who are experiencing homeless or housing insecurity in a more conversational manner about their needs and so on. And so this third paper, you'll hear more about it, focuses on the cycle of housing insecurity. And all of this is part of our effort with the consortium around encouraging communities to really engage in some deep conversations and look at how we may really need to shift the coordinated entry process altogether. Asking ourselves if people who are vulnerable and experiencing housing instability are really getting into those precious housing resources, and ways that we need to shift our system and create some systems change in order to do that. So I'm going to turn this over to our brilliant presenters, Dr. Shanti Kulkarni, Evelyn Hill, and Wanda Gilbert-Coker. Again, we'll be following the chat box to see if you have questions, and I'll chime in towards the end if we have some time for some Q&A.
Great. Thank you so much, Kathy. I'm Shanti Kulkarni, and I think what we can do is we can just, I'll just introduce myself and let Evelyn and Wanda also introduce themselves before we get started. So I'm a professor of social work at the University of North Carolina at Charlotte. I've worked in the field for over 20 years starting out in a rape crisis center and doing some program development and different things along the way, but now my main focus is doing research. My research really centers on looking at the impact of trauma, violence, and abuse on vulnerable populations and how we can use that knowledge to promote like healing within all of our service delivery systems and programs. So that's sort of what I do. Evelyn, do you want to just introduce yourself briefly?
Okay, my name is Evelyn Hill. I'm a certified peer support specialist and advocate with Change Choices. I'm a formerly incarcerated woman and a survivor of domestic violence.
Thanks, Evelyn. And Wanda, do you want to introduce yourself briefly?
Sure. My name is Wanda Gilbert-Coker, and I am a human rights and Black liberation activist and a low-income housing advocate. I reside in Raleigh, and I am with various organizations that represent women, but most predominantly the North Carolina Black Women's Roundtable and North Carolina for Black Lives.
Okay, thank you so much. And Evelyn, we can advance to the next slide. And so Evelyn was part of the research team that collected this data originally, and Wanda we've invited to join us for some conversation just so that she can sort of share with us sort of some of the implications of what we learned about in this study. So I just want to acknowledge all the people that were involved in the study. We had a team in North Carolina, you can read their names there, and then also a team in the DC area. And I'll talk a little bit about the different populations but primarily we were engaging with Black women in North Carolina, many who were formerly incarcerated and had different kinds of barriers. And in DC, there was more of a focus on the Latinx and immigrant community. So we're very grateful for the fact that these women trusted us and shared their stories with us. And then also for the input of really committed advocates who gave us feedback as we tried to develop some of the recommendations. So we can move to the next slide. And just to give you a quick overview of the study itself, we held groups, about 14 groups over the course of a year. And the first series of groups were groups that we did to kind of ask women about, as survivors really, about what their experiences were around housing and what some of the challenges were. And then after we kind of pulled together the themes, we kind of went back and spoke with more survivors and asked them what they thought of the model we developed, and we adapted that model. And the model for this, if you're familiar with it, it's a community-based participatory research method. And so what that means is that I bring sort of my experience as a researcher and knowing how to collect data and analyze data, but that I'm really doing it in true partnership with my co-researchers who have like lived experiences, who can make sense of and also engage folks in the process. So next. So the interview guide we used was kind of semi-structured. So we had some things that we wanted to hear about, but we really let the survivors talk about what they thought was most important. As I mentioned, we developed a model after our preliminary groups, and then we took that back for feedback. And I should note that for the DC groups, those were in Spanish. So we had a Spanish team that translated all of that and also helped us to make sense of it culturally, the meaning of that, those data. So next. Okay, so this is the exciting new diagram. So I want to thank everybody who DVHTAC who helped put together this diagram. So this kind of illustrates what we found survivors were saying about housing. And I think there's a lot of information in this one diagram, but I think what you can tell is that a lot of things affect survivors' ability to get housing and then to keep it. And then often the housing is so unstable that they end up losing housing and they're right back in that cycle again. And so I think what's important for us to really think about, and I hope we'll have a chance to reflect on it later, is where are our interventions and where are we in terms of trying to help people? And I think too often in the field, we might be helping people get housed, but we're not as much focused on having them keeping the housing or preventing them from losing housing. And there are very few pathways where people can get to actual stable housing where they can kind of build. So next. All right, so some of the things that we heard about getting housing is that pretty much universally, finding and securing appropriate housing was difficult. And so we heard over and over again about the lack of affordable housing options, and that there was pretty stiff competition for these units, that there's a shrinking stock of affordable housing. And because of that, landlords get to be pretty choosy about who they rent to, right? So there we heard a lot of stories about how someone's past or what somebody looks like can really impact whether they're able to access that housing. So that's where a lot of stigma and discrimination stories kind of came in. And we heard this, that these were shared around even from service providers to landlords to the general public, is that people really experience that sense that maybe they weren't worthy of housing, or maybe it wasn't worth taking a risk on somebody like this to provide housing to. And formal services were interesting because sometimes they were, for some survivors, very helpful at actually getting housing and provided information, the advocacy to overcome some of these barriers. But at the same time, excuse me, that services were often really siloed. In other words, it depends very much what door survivors walk through. So if they were walking through a healthcare door or a substance abuse door or a mental health door, the folks that were working with them might not know anything about housing. Some DV programs have great housing expertise and others don't. And so depending on what program was serving them, they might not receive very much assistance with housing. So Evelyn, I wonder if you want to comment on anything that stood out to you in these stories about getting housing.
I think the main part that stood out is when people went and they did applications for housing and were either turned down because it had been found out that they had interactions with the police, even though they were survivors of the situation and not the perpetrator. Landlords didn't want to rent to them because they were more worried about their properties being torn up, if the perpetrator came back or if they got back together. So it was a real issue about, even though they may not have caused the damage because the units were in their name, that prevented landlords from wanting to rent to them. Yeah,
that's a really good point. And then we also heard about if there were police called, that might not be somebody that you'd want to get involved if you thought there might be police coming out, or if there was damage to the unit because of the violence, that might be another way that landlords weren't willing to take a risk on women, even though they weren't responsible for those things. So can we look at the next slide? So in terms of keeping housing, what we heard is that people, once they got housing, really didn't feel all that secure that they would be able to keep the housing. And that was because of a lot of different kinds of reasons that were pretty substantial, taken as a whole. So sometimes, there were just things in the environment that weren't ideal. Like, so some survivors talked about ending up in neighborhoods where their partners had access to them, where there might be stalking go on, but even if they had safety from the stalker, they might not have safety within the neighborhood, just because the units they could afford might be in really unsafe neighborhoods where there were drugs or violence, or whether they lacked transportation to be able to get to employment, or a grocery store to get food. And so not having access to these basic things was a big problem. The housing conditions themselves, I mean, there were some pretty awful descriptions of what these were like, but you can imagine they could be overcrowded, but they could also be really almost uninhabitable because of mold and vermin issues. The other thing that we heard about is even if you're in an affordable unit, that's probably straining your budget, especially for survivors who are not working or doing low wage kinds of work, or had healthcare problems, or also paying for expensive childcare or transportation. Like, all of those things kind of strain their ability to make the rent. And the other thing that we did hear about, which is really significant, is sometimes at the point of housing is when people begin to take a breath and fall apart, because they're on such high alert during the time, they're just kind of holding it together during the housing crisis. And then once they're housed, all of a sudden, just the weight of everything they've been through starts to really affect their mental health. I think the video did such a great job of talking about network impoverishment, and that's something we definitely heard, is that that survivors were struggling, but everyone around them was also struggling, and so that that meant that they could help each other sometimes, but it was really strained, right? Like, and so sometimes I might be the one receiving help, but sometimes people were asking me for resources as well. So it's really a two-way flow, and it makes it hard to build up resources. And the other thing that was interesting is they talked about even these family and friends, a lot of times there have been, those relationships have been damaged by the domestic violence. And so if the partner had isolated them from family, or created rifts with the family, those situations happened. Or it could be that they had left and gone back too many times, and their families were frustrated with them, or drawn into that. So that was another barrier, because these relationships had been damaged many times and needed to be healed and restored. We also heard stories of sexual exploitation. So survivors, in any way, people knew that they were vulnerable in different ways, and so sometimes they experience sexual harassment around rents or repairs, or other people coming around. So that was definitely something that happened, and that also was triggering for survivors, especially those who had sexual abuse histories or violence histories. And then we also heard about, again, formal services could be useful in keeping housing, so if you need help with the utilities, or, paying certain bills, that could be helpful, but they weren't accessible. There were many hoops to jump through, and many, you might have to take off time from work to go. It might be unclear how much assistance you could get. You might have to provide a lot of documentation about needing this kind of help. And so those kind of barriers really had a cost benefit to them, right? As far as accessing some things that could be supportive. So I don't know, Evelyn, if you want to comment also on any of these things that stood out to you.
One of the main ones that stood out, and I think when we talked to several of the ladies, was the sexual exploitation. Landlords not really wanting to fix things in the unit. And it could have been because of a situation that took place, a fight where something was broke, and the woman not being able to pay for the repairs, and them kind of pressuring them into sex or sexual favors or acts. It was a very difficult thing for some of the women to talk about. And then the other main one I would say would be family and friends. And that was even a situation with me because I had gone back so many times. My family kind of got sick of it, not wanting to keep coming to my rescue, not saying they didn't love me, but they would leave. And within hours, I was bringing them back in through the back door. It was easier to stay at that time in a relationship that was harmful and even toxic, but financially he was taking care of the bills, which allowed me and my 4 kids to have a little easier life. So I was willing to forego some of the pain and discomfort because I hadn't been working and he was the sole provider. And I see that with a lot of the women that we talk to, when that person has kind of isolated you from your family and friends and you have no other recourse, that person becomes your everything, almost like becoming your God. And just not really knowing a way out. And that's the hardest part. You know, it's not like you just leave. It's not like I walk out of one apartment and I can immediately walk into stable housing that's safe. And then if you add in the fact that some of the ladies, including myself, had children that may have had disabilities or was other issues that came into play, it's just easier sometimes to stay.
Yeah, thank you for sharing that. I think that really drives home like all of the things together, right? Like it's not just one of these things that's happening, but it's multiple. So can you move the next slide, please? So finally, the part of this, the cycle of losing, the part of the cycle that's losing housing. And we heard that a lot, that I think almost practically, probably Evelyn, right? Every woman had a story of some kind of housing loss. And that could be due to eviction or gentrification or some other financial or housing crisis. So there were different reasons, but it was a very, very common experience. In the state of North Carolina, those evictions can happen pretty quickly. Interestingly, in our immigrant sample, what we heard is like a lot, and I think it was true in both groups, but they talked a lot about because of their status, it was hard to even get a lease. And so they might not be evicted, but they're living in sort of without a lease. And so then it was really easy to get pushed out, and also no protections at all if things are going wrong. And the other thing we heard people talk about is this issue of gentrification that is so powerful, and how they might be staying at a certain place that was affordable, but when rents can go up pretty quickly in some of these neighborhoods that were once affordable and they're no longer affordable. So can we go to the next slide? Oh, I'm sorry, Evelyn, do you want to add anything there?
Well, when you talk about, and Wanda can probably speak to this, but I'm also from Raleigh, and I think about when they came in and they tore down some of our public housing complexes like Chavis Heights and Halifax, and they rebuilt what they said was going to be affordable, what turned out not to be so affordable, which caused people then to scramble and look for housing situations. And that makes it kind of difficult because if you don't have anywhere to go, then you're more than likely to go back to the only thing that you know. So I really want to try to drive that point home. When evictions happen or when there's a change in the neighborhoods and you no longer can afford to live in certain things, you're scrambling at the last minute trying to find something, which sometimes can put us into very difficult situations, unsafe neighborhoods that's riddled with drugs, violence, gangs, which is not really conducive if you're already dealing with cycles of violence.
Yeah, I'm really glad you said that, Evelyn, because it reminds me just of that feeling of desperation that the women talked about a lot, that that you're having to make these hard decisions and you don't have a lot of options and you don't have a lot of time either. And just the pressure and stress around that was pretty significant. So now we can go to recommendations. Okay, so we're going to share some of the recommendations. And again, these were recommendations that we kind of developed through the validation groups and also took to some of the advocates and policymakers we knew to kind of get feedback and pull them together in a sense of what does this mean, and how can we begin to disrupt this cycle for these survivors that we're wanting to help. And so the first one I'll talk about, and I have kind of a quote from each one just to bring in that voice, is that healing and empowerment are possible, and we heard that many, many times, but that survivors need comprehensive and survivor-centered trauma-informed care. And this is a quote from one of the survivors who says, "Nobody ever asked us what we need and what we want. I think your needs just start being incorporated to not just push the agenda of your agency." So in other words, like, I think, Evelyn, were you the one that was talking about getting a computer when you got out of?
Yeah, I did. It was almost like when I first came home from prison, I didn't want to return to Raleigh because I didn't want to return to old habits and situations when things got difficult for me to return to what I knew. So I chose to stay in Charlotte. And one of the first things that was offered to me, which I thought was just kind of hilarious, was a computer. So you offer me a computer with nowhere to live and no way to have internet access, no way to look for a job because you need somewhere where you can bathe. It was just like my basic needs weren't being met, but you thought handing me a computer was going to solve all my issues at one time. And I really just feel like I needed someone to hear me and understand. I had kids that were in foster care. I had a daughter that was incarcerated. My son was in a mental hospital for cutting. And you hand me a laptop at my lowest point and think that's going to help me re-enter. Yeah, I found it kind of hilarious.
I can think of other words.
Yeah, but I'm trying to be nice.
Yeah, no, but it is really powerful. Like, I think, people who are well-intentioned, organizations who are well-intentioned, all of us who are well-intentioned, but if we don't stop to ask, what do you need, and think about how can I provide that for you, like, we're not really meeting survivors where they are, right? And we're not really helping in the way we could be helping. So I think a lot of great work, survivor-centered advocacy has been happening, but this just to me reinforms we just have to keep pushing that, right? That people have a lot of different needs, but those needs really need to be centered around what do survivors say they want and need now, and how can you provide it?
And sometimes it's just really something simple. If I'm walking out of a facility after doing 7 years, I don't even have a coat. It's the dead of winter. What do you think I need more, a coat or a laptop? What do you think I need more, a pair of gloves and a hat? Or you to take me to dinner? I mean, I need people to be more conscious. And I understand you want to help. We want the help, or at least we want the assistance, because we want to still feel like we have the opportunity to choose the direction that we want to go in, and not have something kind of crammed down your throat. I really feel like we need to be looking at people's basic needs first before we can do anything else.
Yeah, thank you. Can we move to the next recommendation? So the other thing that stood out for us is that formal services can improve survivor access to housing resources, but it means that we're really needing to do more of this cross-sector collaboration. So this is a quote from a survivor who said, "My caseworker said she didn't know what to tell me about housing because that's not her job." And that's a really common thing that we hear, is that the person in front, we might not have the expertise to give that housing to provide that housing advocacy, but we really need to be building that expertise through relationships with people who do that work, who are experts in those fields. So it's certainly true about housing, and it's about other things, but that's really an area I think where we can grow our advocacy. And actually I think DVHTAC is doing a great job of kind of modeling that. Did you want to add anything here, Evelyn?
No, you kind of summed it up right there. You're right. If I don't know something, even in my field, if I don't have access to a referral or the resources, one thing I do have access to is a phone and a computer. If you don't know, then seek. But I think the worst thing to tell anyone, whether it's domestic violence, incarceration, HIV anyone is that you don't know, because that tells me you don't want to find out.
Yeah, that's a great point. Can we look at the next recommendation? Okay, so this was an important one that survivors really want, the survivors that we spoke with. Like, it was kind of incredible, I think, how long these groups went on, because I think people really wanted to talk and really wanted to share and really wanted to be heard. And I think part of why that's so important is because there's so many negative stereotypes about domestic violence, about incarceration, about immigration, and about race. And when you really see that person and hear the story, you can't just think about them, or it's much harder to think about them in these negative stereotypes. So, so I'll share a few. Prison is something that happened. It's not who I am. Domestic violence is something that happened. It's not who I am. And you're not going to define me by what you think I should be. Nobody can put me in another box. And another woman says, I can work 2-3 jobs and still people don't want to take that chance or even allow me the opportunity to live in a place that's conducive to being a productive member of society. So I don't know if you want to say more about that, Evelyn.
Well, I was the one that said the part about the 2 jobs.
Know.
So I was working 2 jobs, and I was a full-time student. I am still a full-time student at Central Piedmont Community College in the substance abuse field. And it was just funny that we had a city council meeting. They asked me to come speak, and we were doing for the $50 million housing bond. And it was funny that for about 3 weeks after I spoke and it made news in North Carolina, everybody was willing to step up and help, as people like to say, oh, we're going to help you find housing. This was a time where me and my kids were still not reunified, and where the system was taking care of my kids. However, I had the ability to take care of them. I just didn't have housing for them. And for those 3 weeks, my phone rang every day, all day. And then when the next big story hit, I was kind of thrown to the side and I still didn't have housing. So it took me 18 months from the time that I was released from prison, 18 months now of working and going to school and being productive and not reoffending, for me to finally found an agency that was willing to give me housing based off a situation that one of my kids had. So it wasn't even based off they trusted me. It was based off of a situation, a medical situation that my son had that allowed me to qualify for this particular housing situation. They didn't care about my background then because it wasn't based off me. So still, it didn't matter that I came home and that I was working and advocating and going to school and paying taxes. I still couldn't find a place to live for 18 months. That should never be acceptable.
Yeah. You know what, also what you're saying reminds me is that just your phone ringing off the hook because people want to help that one individual. And I think we have to like put it in, and what might have really helped. I mean, you needed that support, but also we need to change the policies and provide resources so everybody can have that. So let's go to 4. So another recommendation we had was that survivors want protections from housing discrimination and tenant exploitation. And this is just an example of a survivor saying, to be able to stay there, we stop complaining because you know you need a place. And since you're paying what you're paying and you don't want them to throw you out, you just ignore your needs. So I think there are protections. You know, protections vary by location, but people aren't always enforced, or people aren't always educated about what their rights are when it comes to housing. I don't know if you wanted to add anything here or not, Evelyn.
No.
Okay, so let's go to 5. Communities need affordable housing resources and equitable access. And this quote is, I mean, it's like everybody trying for that one house, and these people know that, and the landlords know that. So they just rack up the prices because they have all these different people who are trying to get one house. So as long as we have one house, we're going to have this problem. Like, we need more options for people. Otherwise, we're just clearly in the situation of competition. And what happens then is that this discrimination and these bias issues really interfere with people being able to equally access these resources. Did you want to add anything here?
No, ma'am.
Okay, and then the final one. And so we really believe, though, that larger than that, that we really have to look at comprehensive community investments to look at sort of what are some of the underlying causes of housing insecurity. So we can do our part with survivors, but we really need to think about the communities that we all live in, that we are part of, and what life is like in those communities and what those communities are physically like. So the quote here is that neighborhoods are filled with abandoned houses or houses that aren't kept up. You have certain landlords that will rent to us, but what they want to put you in, you wouldn't want to live in, because it's not made for a family. It's not made for kids to feel safe. I feel like it's throwing on a Band-Aid on something and just saying, here, we're giving it to you, be quiet, go away, go sit in a corner. And I think it really, when neighborhoods are kind of in this state of just neglect, and it just really communicates that you're not worthy of more, right? That we don't care enough about this community or this neighborhood to really make the investments that need to be made, and that isn't true in other parts of a town or where people live, right? That we know that, and that makes a difference. So I don't know, Evelyn, if you want to comment on that.
Yeah, I will say this to that. And it's almost like a public service announcement. We're not going to go sit in a corner, and we're not going to go away, and we're no longer going to be quiet. We're taking our power back. We deserve the same things that everybody else deserves. We deserve to live in safe, affordable housing. We deserve to be with our families. We deserve not to be mistreated, not by the system, not by significant others, and not to be used by organizations that want to push their own agenda. We are no longer going to take it.
Yeah, that's a great place to stop this presentation. But I think now we're going to shift into questions. Okay, so I don't know. I'm not sure if Brittany or Kathy, were you going to kind of pose questions from the chat box, or some questions if you had to get us started?
Yeah, we had one question in terms of who was involved in your listening sessions, and somebody was curious about American Indian and Alaska Native communities, if they had a voice in contributing to this research.
No, unfortunately, but it would be great to go there. This was just, kind of a short funded. we could only do what we could with the funding, but I think those are voices that really need to be represented, and I hope they will be in the future.
Yeah, it certainly points to more research that we need. And I can also let folks know that we, with the consortium, have also been involved in supporting the Native housing work group that has put together a really comprehensive report on housing insecurity issues for survivors from American Indian, Alaska Native communities and tribal lands. So I think Brittany's probably going to put some of that information in the chat box as well. And yes, we are going to be in the next year ahead putting together some listening sessions to learn more about Native American and Alaska Native survivors, as well as youth from those communities who are experiencing housing instability. So lots of information coming down the pike.
Yeah.
And that was, I think that was all I saw in the chat box in terms of questions. There were quite a few folks who were appreciative of the powerful comments and offerings that Evelyn was kind of unpacking. And I think that's all I saw in terms of the questions, but folks can feel free to add more. And I believe you have some questions to discuss as well.
Yeah. Oh, okay. I got confused about who was going to ask them, so let me pull them up.
Oh, okay. I can pull them up. No, I can pull them
okay.
up.
Yeah, we could. But I wonder, Wanda, since I would love to bring you into the discussion, did you have any sort of just general comments or reactions or perspectives on what we're talking about?
Yeah. Yes, as I look and listen to the slide and you all's comments, I mean, everything sounded oh so familiar, I think, you know, pretty much regardless of where you live in, if you're living in an urban community, urban city, you know, where there's gentrification, that, you know, it is affecting not just your networks, but also resources in the community that you desperately need. But, you know, I see gentrification as, I align it with, you know, unfortunately for some, it may be hard to hear, but for me, the way I see it, gentrification is sort of like slavery. Instead of people being sold on the auction blocks, our houses are being sold from under us, and we're being displaced. And gentrification divides families just like slavery did. And there has to be some type of recourse for people, whether it be reparations or whether it be some type of atonement to end that racial inequity that it is happening in predominantly Black and brown communities. And when you divide up the community, you are dividing up that network and those resources that you need that may be holding you together. And if you end up in various parts of the county or various different parts of the city, you know, and you're going through domestic violence, it could get worse when now that you're alone, you're separated from your network and community. So.
Yeah, I think that's such a great point. I'm wondering if you can talk, and maybe Evelyn, you have too, when you talk about how folks can be safe in their own communities, because I think one thing we also hear and understand is that for survivors of color, calling the police as a whole isn't always an option that they're interested in for a variety of reasons. So what does that mean in terms of how communities can keep survivors safe, or how we can work with communities to keep those survivors safe?
You know, in the work that I do, we have this saying that we keep each other safe. And, you know, since the police killings and the Breonna Taylors and different things that go on with the police, we don't necessarily see them as an enforcement that's willing to serve and protect. More or less, they're there to basically enforce the laws or policies that they have in place that marginalize us and hurt us. So I think we have to get back to that community type policing. I remember growing up in the rural North Carolina, and we had community watch. Well, you know, now there's next door, you know, and other things that can help, where you don't necessarily have to call the police, but maybe, you know, within your community, you know who is who. There are some people in your community that may even have law enforcement or some type of social services background that can help someone that is going through that domestic violence. You know, it used to be the church. Unfortunately, the churches have been affected by gentrification as well. So finding that resource maybe within your community that can offer some type of assistance or help.
That's great. Evelyn, do you have thoughts on that too?
I have to agree with Wanda. I think we need to get back to the basics. It used to be, you know, it takes a village to raise a child. Now it's like everybody's behind closed doors, and you now hear, and I've even heard my kids say it before to me, you know, you don't discuss what goes on in this house. What goes on in this house stays in this house. Well, I'm a firm believer that secrets keep people sick. And if you allow things to take place where we don't hold each other accountable, I'm no longer looking for the police, especially not the police, to protect me. I now view them, and a lot of African-American people may view them almost as being like the perpetrator, because we don't know what reaction we're going to get if we reach out to call them. We don't know if we're going to have a knee on our neck. We don't know if we're going to get shot 30 times. We don't know if we're going to be the one that's arrested, but we've called the police seeking for help. That's enough to make us not want to call the police. And then you want to try to reach out to your brothers or your uncles or the elderly lady that's down the street that may babysit kids. I had all of that growing up, but by the time I hit my early 20s, it was abated. It no longer happened. People didn't say anything to other people's kids. We weren't community anymore. We became individuals, just living in society. So basically, I feel like we took the human out of humanity.
Yeah, and I heard what you said, Wanda, is that gentrification is only making that worse because it's sort of destroying what little structure there is.
Yes, definitely.
Yeah.
Even when it comes to the school systems, gentrification is destroying that, because even if you were going to a school where you felt comfortable or where you could go to a resource in the school or as a child, find some safety there, gentrification is changing that, because you may end up at a school where all of that, where you felt safe, is no longer available.
Yeah.
Sorry, this is Kathy.
I hear you trying to get in, Kathy.
Well, no, this is an important conversation and I don't want to cut it off. I think there's a question that touches on it somewhat, a question that's come through the chat box that I just wanted to add in and see if it connects to what you're talking about, or if you want to connect it. The question was recognizing that much of what you've already talked about does touch on legal protections that may exist. And besides the criminal legal responses, obviously we need to think about other legal protections. And so the question is, how can those of us who have legal training ensure that those rights are well known and connect survivor advocates with that information to be able to advocate on behalf of and with survivors?
Yeah, I think that is such a great question and great resource to pull on. I think it probably depends on, I think where I would start is connecting with other people in your community that are doing this work, like kind of surveying to see like what the needs are and who's doing it and how can it be enhanced, or if nobody's doing it, how can we create something? But I feel like what's important in this work is that we can't do it alone. And so we have to kind of find groups of people that can work together on some of these issues that we want to tackle. I don't know if that kind of gets at what your question is, but do you have thoughts, Wanda or Evelyn, about like the civil legal protections, and how would that be most accessible, do you think, to women who need it?
I think, resources like this, webinars, especially since COVID-19, it's harder to get out. But for those who have access to the internet, different webinars that like Legal Aid gives, other like bar associations, classes that's online that they give that may be free, I think will be very helpful. And so when a person is deciding to get out and they're making that choice, they have some resources, or they understand the legalities of like moving the kids in and out, or moving to another state, if they can, if they can't do it. And so I think just tapping into those resources that are online now due to COVID. But, in a non-COVID society, creating those resources yourself. Find someone who has that experience and create a Zoom meeting for those who need it, or a class. Ask a church for a space, and bring someone in to inform people.
Yeah, I think so much of what you said makes me think it really is about being in dialogue with people, like kind of to Evelyn's point, to really find out what is it that people want and need, and then what do you have to offer, and then what is missing, and trying to like fill that gap together.
Mm-hmm.
What do you think? Are there any thoughts you guys have about how, in terms of having survivors play a more active role in some of this work? Survivors who, at whatever point they are in their healing. Do you have thoughts about engaging survivors and what kind of opportunities survivors might be interested in?
I believe that to engage and to get accurate information and to educate, everyone must have a seat at the table. So we need to bring survivors in, police in, judges in. We need to bring in activists. We need to bring in the lady that lives down the street. We need to bring in social workers. Everybody needs to be at this table for us to be able to make a change. A change cannot occur with just one person. It's going to take the whole village. It's going to take everyone giving their input and then following through with whatever recommendations they need. But at the end of the day, you must listen to the survivor. You must listen to the woman as far as what does she need and where she is in her stage of recovery.
Yeah, I think that's a great point. I'm also thinking about the kind of organizations that you guys are connected with, aren't always the organizations that domestic violence agencies think about partnering with. So like the work that you have done, Evelyn, with Change Choices, and the work you do, I'm gonna get the names wrong, for North Carolina Black Lives. Is that it, Wanda? And some of the other advocacy organizations aren't always in partnership with DV organizations, and maybe it would help if we were.
Mm-hmm. I definitely agree. I say, we're boots on the ground. We're not just grassroots, but we're also the rapid response people in the community, because as soon as it happened, we know. And often, sometimes these resources that we need, they're closed. They're only 9 to 5 businesses, or they're a 800 number, but they're in another city. So it's up to us who live within live within the area or wherever it's happening, to connect and build your own infrastructure, build your own network, and for them to, for us, often I see funding go to some of these nonprofits, and these nonprofits generally don't even know how to use the funding. Like Evelyn said, they don't even ask us what we need. They say, okay, well, we're going to provide this and provide that, but that's not exactly what we need. I think if more of that funding went to the people who are on the ground, since we are experiencing it, this is our life, we know what to do with that money, because it's us, it's our lives. And so I think if the funders or people who grantors or distributing the money, giving the money, look at some of these groups that are on the ground, it will we can touch people. And often, the work that we're doing, it's not necessarily that everyone has to know, that a lot of times when you go to these resources, they want to know your name, last name, first name, where you slept, where you this, and blah, blah. And, sometimes you're afraid to give all that information. But because we live here, some of those questions don't have to be asked, because we already know, we already see what's going on. And I think people, the trust is there, because we're not red tape, we're not the government, we're not the overseers. We look just like you, and we're someone who's affected by what's going on in the community as well. So
that's great. Are there any more? Oh, Kathy.
Yeah, if I may, I think that was Evelyn who was just speaking, if I'm correct. Yeah.
Oh, no, that was Wanda.
Oh, I'm sorry, Wanda, thank you. I think that leads into, we've had a couple questions about coordinated entry systems, and that's, what communities are attempting to do in terms of funneling and creating access points for folks who need housing assistance. And you just spoke to those coordinated entry processes are fraught with a lot of really personal questions and asking folks to disclose things that are uncomfortable and might compromise their safety and so on. And so just wondering what you all have in terms of suggestions for how these coordinated entry housing systems can address the concerns that have come up in the listening sessions.
Yeah, I think a lot of the challenges with coordinated entry kind of relate to that. A lot of things we talked about earlier in the findings is that, coordinated entry is meant to provide these linkages to affordable housing, but if there's not much affordable housing, it doesn't really provide access for very many people in most communities. So I think that is like sort of a structural problem that coordinated entry isn't really designed to solve. And so I think we have to like always keep it within that larger context. But I absolutely agree with what Kathy said, is that I think if we really think about our coordinated entry as being trauma informed, being low barrier, like Wanda said, like not having to, what is just the essential information, like if you think about it, particularly with coordinated entry, like if you have to provide a lot of information and you don't even get housing out after that, like that is a pretty demoralizing experience. So I don't know if you guys have other thoughts about coordinated entry, or if you've had much experience with coordinated entry.
When I think about coordinated entry, I look at it as they're looking for outcomes. They're gathering information to give you a resource that may or may not go through. My thing is, if a woman, since we're really talking about domestic violence, if a woman is on the run and she says, I'm trying to get out, I need to get out now, the last thing she needs to do is be given her name, date of birth, and social security number. We need to have people with boots on the ground that says, okay, I need you to get to this location at this time, and someone's going to pick you up and we're going to move you to another location. We're talking about people that's running for their lives, and they don't need to be sitting on the phone for 30 minutes answering a bunch of questions. Do that part when they're somewhere where they're situated and safe, even if it's just a temporary location until we can move them to the next location. And like Wanda said, they're boots on the ground. They're in the community. They know if I'm living on Pool Road, I don't need to go down the street to Rock Quarry Road. I may need to go to Durham County. I need to be able to move quickly and not be filling out a bunch of, paperwork where you're trying to get certain things done so you can continue to get funding for your outcomes. Because guess what the real outcome is going to be? Whether I live or die. That's the outcome. Whether I live or die. Am I here tomorrow to fight another day? Or am I somewhere getting put in the ground because you needed my social security number?
So true, Evelyn. And you touched on something that I was just thinking about, the funding piece. Generally, this information, because I am a survivor, but I've also worked the other side. And I know it bothered me to ask a lot of these questions, but what I found out is that they need it for funding. They need it reported to the city. They need it reported to the county, or they need it to report it to the private donors. And I also feel like it's a way to keep tabs on people. Instead of seeing people as human beings, they're seeing people as numbers, and it's it's for financial gain. And I think if some of that is if the funders and the people giving the money realize that this interfering and putting someone's life in jeopardy, I think that's a good place to start those conversations with them.
Now, let me say, I'm all for outcomes. I work in a job where I have to produce outcomes. My thing is, at that moment, in the moment, I don't need that information from you. I need to get you somewhere safe. At the end of the day, that's what I'm thinking. I understand. I'm all for people getting the information, but let's get the people safe somewhere first, and then we can do the paperwork.
Yeah,
because the paperwork and they're not safe, you've done the paperwork for what? The outcome is still death.
I know. And the other thing I'm thinking about, Evelyn, is how, like when you ask those like if people don't trust you to answer those questions, or they're not sure how that information is going to be used, like the data they're collecting is not even real. Like, I think people have to feel comfortable and trusting enough to really provide you with like the real situation that's going on for them. That would make a difference in how they get prioritized for housing. And that doesn't happen with the first time you meet somebody, generally, you know?
And you're correct. There's so many times that I called 211 is what we call, and by the third question, I hung up the phone. I didn't feel comfortable. Then I reached out at the time to who was my CPS worker, my child protective worker. And when I told her I was ready to go, when I say some people do go above and beyond, she got out of her bed at 2:00 in the morning and picked me up at the Greyhound bus station with 4 kids and nothing. Now, did I go back? Yes, but that's another issue. That's a cycle of violence. To go back, the honeymoon stage, I went through all that, and I went through it multiple times. It took me 12 years to leave and gain my voice and stay gone and be okay with me and knowing that I would have to do whatever I needed to do to take care of me and my kids. But at that time, I hung the phone up. You're asking questions, and I'm telling you, I'm scared. I don't need questions at that time. I need a solution. I need somebody to tell me what I need to do, because for so many years, I've listened to other people and I didn't know what to do. I had no voice. I'm reaching out for help and there's nobody there. And then people don't understand why we become traumatized again. And I'm sorry, I'm getting upset, but I just listen to the excuses after excuses, and people don't understand why a woman will go back and go back and go back. Because if I'm going to be traumatized at home, why do I need to let you traumatize me? I might as well stay where I'm at.
Right. I definitely agree.
Thank you, Evelyn. Like that. I wish I could give you a hug right now. I think it just shows how, you know, just in doing our jobs, how when we're trying to help, we can be harmful, you know, and it takes some self-awareness to really slow down enough to really think about the person on the other end and what they are experiencing, what they might need. Like, I know with other survivors I've talked to, like one of the things that is so compelling for me is like, a lot of people are used to being told, no, you know, we can't help you or we can't do that. But it's not being treated with dignity and compassion and love. Like that is really, I think, the greatest injury, right? Yeah, to be treated like a number. I know, I feel like we're all breathing together. Or hopefully, maybe we should breathe. And Evelyn, I said, we don't feel sorry for you. We respect you. And I'm very proud to know you, because you're an amazing change maker.
Yes, you are a conqueror.
I remember there being a question. I don't know if we asked this already, but just to really honor what you folks have shared about the bigger changes that are needed and to move beyond excuses. What do we need to reimagine collectively to actually assist and actually not even assist, but provide what you were saying you need, and then create the conditions that you no longer have to ask for these supports and can create freely.
You know, when COVID happened, a lot of us were locked in, but yet we still were in need. And I saw community come together like no other time to help with food, where you could just drive up somewhere, just like a drive-through, and they put it in your trunk. And so for you to stay safe. I saw community making masks. I saw community bartering with each other. If I do so much and so many in masks, you know, we can barter on seeds. I saw seed exchanges, people starting community gardens or sharing what was in their garden with others. So I know it's possible, and I feel like, you know, many of us are back at that place, where I attended online a class where they were teaching about how to store food. And I remember my grandma and them, you know, they did it, but you know, we're so used to going to the grocery store and buying that chicken or buying whatever, and you know, it's there every day. But you know, getting back to those old things of canning food and ensuring, you know, there's the kids are taken care of because of virtual classes now, and people having to go back. I've seen godparents, you know, start watching the kids so the mom can go to work because the mom is an essential worker. So basically what I'm saying is that, you know, what I imagine, I know it's possible because I saw it happen. I've seen it happen, and it's still happening. Due to COVID, it made us see, you know, life different and how to take care of each other, even through self-care. So, you know, like I was saying yesterday, I feel that what we need is in our community. We just have to create it and reach out to those people and find out, you know, oh, do you sew? Do you know how to make, you know, certain types of food? Do you know how to watch? Do you have experience watching kids? Do you know how to work on cars? Find those people in your community and build a network. And that's what not only I imagine, but I see, and it's possible. And if we, regardless of when COVID is over, you know, if we keep this unity that many of us have built and shared, I think, you know, we're better off as human beings.
Wanda, that was such a beautiful description, and it's like a community I would want to live in too. And it makes me feel like, you know, in majority communities, we need to follow that example, right? Like we all need to be living in more of this interconnected way where we see each other's humanity. And it's really inspiring to hear like that that's happening where you are.
Mm-hmm. I like what I saw someone type in the chat. They said systems should be community-based, transformational, not transactional. And that is so true. Thank you, Kathy. Kate.
Yeah, I think that's true too. I like that. I'll like it's, and I think if we get out of a way of thinking like you do this for me and I'll do this for you, and rather think about like how can we all be better, you know?
Yes. Yes.
I don't know much more what we can say after this.
I think that's a good place to pivot if there's no more questions.
Well, I think there's still around some question around what's happening right now that might give or that gives you hope for some positive change. Wondering if you want to speak to that.
Evelyn, is there anything that makes you hopeful right now?
Well, one of the main things I say that continues me moving and pushing forward is as long as we continue to have conversation, because without conversation, there can be no change. So to move forward, we need to continue coming together, whether it's virtually, in person, sitting at a round table. You know, we really need to bring policymakers and change makers together so they can really understand what is needed. It's really easy to, you know, sit high and look low and make decisions on people's lives that you've never met or that you have no, no history or no interaction with what they go through. But the only way that you really can see it, like I said, is the people that's on the front lines. It's the people, we have people out here is doing the work, successfully doing the work. And I just wish that, nonprofit or for-profit agencies, you can't do it by yourself. You're gonna have to collaborate, because you may have, experience here. This person may have experience there. Like Wanda said, it's just like growing a garden. I don't know anything about growing a garden. My grandmother did. She grew everything that we ate. But I do know that she would say, go pour water on that and something would sprout and bring forth. And it was food. So you take people that have different experiences and expertise, you put them together, you have a real conversation, and then you implement change. It's all good to talk about it, but I need to see some action. You go back into your respective communities. Don't let the conversation stop because the webinar stopped. The conversation has to continue for change to happen, and then you have to implement that change. The people that we vote into office, they work for us. We don't work for them, so we need to hold them accountable for their lack of or their progress. If they're not doing it, replace them. If they are doing it, we keep them. We no longer have to continue to settle and think you're going to do what you want to do when it's my life that's on the line.
Yes.
My God, Evelyn, that is so true, especially when it comes to these policymakers, these politicians, and we're going to vote, but we also need to find out what is their platform on women's rights, women's issues, on domestic violence, sexual assault, human trafficking. Have those conversations with these politicians that you're voting for, and know where they stand. I know one of the things that we're working on with the housing organization I work with, the Wake County Housing Justice Coalition, we are working with a statewide organization, Action NC, and others, and we are exploring how to include evictions as a evictions that can how to include evictions in the expungement system, how we can get evictions expunged off your record, just like other things are being expunged off your record. We feel like that would help a lot of people, especially Black and brown women who are usually head of the households and who paying late or being evicted or going through domestic violence and all of that, or being able to get that expunged off your record not only will help, as far as finding housing, but it will also help probably more than likely with your credit. So, that's something we're exploring and we're working on, and hopefully after the elections we can find some, we can lobby for that. So.
That's a great issue that we could all take up, right? Like that would really help survivors, like learning about how these evictions can be expunged in your community and asking those questions. I don't know, I mean, in Charlotte, if that's possible or what the steps you would take, but that's something I need to find out.
Yeah, actually the group we're working with, Action NC and others, they are in Charlotte. It's a statewide organization that that I work with, that we deal with primarily housing issues, housing justice, from Charlotte, Winston-Salem, Greensboro, Raleigh, and I'm sure I'm missing a town, Greenville area, Eastern North Carolina, are part of the group. And it's open to others as well, and I can send you the information.
Yeah, please do.
Mm-hmm.
I see, Stephanie, your question in the chat box about the decision tree and about how soon that would become a part of the coordinated entry system. I will put my email back in the chat. We're connecting folks who are interested in implementing the tree. I can also move to the survey that we're asking folks to complete. I'll come back to the presenters' information in just a moment. But we are asking folks to complete this survey. We're interested in mapping who's doing what and then facilitating connections among those folks who are interested in doing similar things and experimenting together and reimagining, as Wanda and Evelyn have been calling for. So I'll pause there and see if anyone has anything else to add.
And Brittany, do we have the registration for the November 19th webinar available?
I do, yes. I will share that in just a moment.
Yeah, we'll be talking even more about the decision tree and some other innovative practices that communities are testing out in various parts of the country. So does this feel like a good point to wrap up? I'm asking our presenters if there's anything else you want to put on the table for us.
I think we've said a lot. What do you guys think? Is there anything else that you'd really like to share before we end?
Nope, that's it for me.
Well, there's a ton of affirmation in the chat. Everyone is hugely, hugely grateful for you being here, Evelyn and Wanda. Thank you for sharing your brilliance and your expertise. And I can only hope that we really center and listen to the voices of Black women and Black survivors so much more than we have.
Oh, yes, yes. Thank you all. I appreciate the opportunity. I appreciate it.
Well, I'll add my appreciation as well for the time and for the insights and for not only bringing your voices, but also bringing the voices of others that are participating in the listening sessions and in your community. So thank you. Brittany showed everyone that slide about the mapping survey that we've started, and you can also see on your screen, this is a compilation of COVID-related resources that may be of help to all of you. And I think we have one more slide, just acknowledging who has supported this particular webinar, and we appreciate the resources and the support from our federal partners to help us bring this forward. So thank you one and all. Let's wrap this up. Again, the recording will be available. Don't forget to check back to safehousingpartnerships.org frequently for information about this webinar and other webinars and resources and things like that. So thanks.
Thank you so much. Thanks for having this conversation.
Yeah.